You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. And with us, we have an expert on the topic, Dr. Matthew Agnini. Dr. Agnini, welcome to the program.
Thanks, Randy. It's good to be here.
Now, before we get into, and I know you brought a stack of photos, so we'll try to get to as many of those as possible. But before we, get into, the process of getting dental implants, who's your typical patient that comes in for like dental implants?
There's typically two types.
Okay.
There's patients that are already wearing dentures and they're just fed up with the loose fit and all the negative things, the ability, or the lack of ability, I should say, to taste food. So what we do for them is we add dental implants, upper and lower, and give them teeth in just one day that don't come in and out.
Nice. What's the other group?
The other group are the patients that have struggled with bad breath, tooth decay, broken teeth, missing teeth, periodontal disease. These patients have been putting off doing something because maybe they don't want to end up in a denture like their grandparents or their parents before them.
You get a lot of that?
We get a lot of these
Where they
patients.
actually say, everybody in my family had dentures?
The numbers say that 170 million people, adults in the United States, are missing at least one tooth, and 40 million adults have no teeth at all.
So for people that, now there's an option, as you say, to get upper and lower teeth that don't come out.
Absolutely.
But the denture wearers are kind of stuck, you say? It's hard to get them in or convert them?
Well, denture wearers know exactly what they struggle with, the looseness, the inability to taste food. But it doesn't matter if the patient already has teeth, failing teeth, or they've been wearing dentures for 20 to 40 years. We can add dental implants in just one day. They leave with teeth that don't come in and out.
Now, if there was an opening on your schedule, let's say you had the opening, somebody watching this today, next week could have upper and lower teeth that don't come out.
Absolutely.
Okay, good. That's good. And how old can you be to do this?
Age is really not a variable. Some people may think that's something that's prohibitive, but we do this for patients ages ranging from their 20s to their late 80s.
So 89 years old, why would somebody like in their 80s want to do this?
Well, Randy, I live by the Villages and I get a lot of patients from that area, and online dating is a thing for people in their 60s, 70s, and 80s, just like it is for younger people these days. People want to be able to enjoy life. They want to be able to go out to a restaurant and not have to worry about their teeth falling out. They want to be able to eat a candy bar. They want to be able to eat a steak. They want to be able to bite into an apple. It's just a quality of life thing more than anything else.
So if everything works out, they get upper and lower teeth, right, supported by implants, they can literally eat whatever they want.
Absolutely.
That you would be able to eat with regular strong teeth.
They can eat anything that you can eat with natural teeth.
Okay. How long can they last if they clean them and take care of them?
The implants in the teeth should be able to last a lifetime.
Okay.
The teeth are made out of a product called zirconia, which is as hard as diamonds. You've heard of cubic zirconia diamonds.
Yeah.
So these teeth are rock hard, harder than enamel even, and the thing is they look as lifelike as tooth enamel. Okay. Very lifelike.
Okay. Now you mentioned the Villages. Are there a lot of people wearing like dentures, like an upper or lower denture, like in your surrounding area? Because I think Florida is such a healthy place.
There's people wearing dentures everywhere. It's the biggest fear for a lot of people that think they might end up in a denture like their parents or grandparents. But for those that already have dentures, they know the things that they struggle with. And sometimes it just becomes their dirty little secret. They just don't want somebody else to know that they're wearing dentures.
So a lot of people wearing dentures, I think you told me, even their spouses sometimes don't know that they're wearing a denture. They think they don't know. Is that true?
When a denture wearer takes their teeth out, their face appears caved in, scrunched up, if you will. That's the last thing they want somebody else to see. So they have it down to a science as far as when they go into the restroom, when they take their teeth out, when they soak them and clean them and put them back in before their spouse or significant other, or anyone for that matter, finds out about it.
Okay. And we should also mention that you're like one of the low price leaders in your area. Is that correct? Because we even make calls and you guys are less than other people.
Yes. I've been in dentistry for 20 years and one thing's been consistent, and that's the cost of dental care has been increasingly climbing. So that doesn't matter if it's crowns, root canals, dentures, or full mouth implants. It's all been going up. I wanted to make it so that it's more affordable.
Okay.
We offer financing. There are things that
Are people financing this?
absolutely.
So it's very common, like every week, every day?
Even with my fees structured the way they are, it's still an investment. We have several different financing options right inside the office.
Because Medicare, Medicaid, even the best dental insurance really doesn't cover it. So they're financing.
Typically not, and if that does cover it, it's going to be like a drop in the bucket. So financing is a tool that's available now that might not have been available in the past that allows individuals to get these procedures done.
So at your office, we need to mention this. So I guess correct me if I'm wrong, how dental implants are typically done. You go to one office that does the surgery, another office that puts the teeth on top, and oftentimes another office that maintains them. You do it all right there. Is that why you're faster? Is that why you're less expensive?
Yes, that's one reason we're able to keep the cost down. It's also a matter of convenience. Patients just don't like traveling all over town or maybe even between neighboring towns to get these procedures done.
Okay.
So now in our office, we can do it all in a single visit.
Yeah, but what about people like with gum disease, the bad gums? That's why they lost their teeth in the first place. Are their gums okay to get implants? How does that work?
For sure. These patients come into our office all the time and get implants. With gum disease, you lose bone and support around the teeth and they become loose. Bad breath is usually prevalent in these patients.
Okay.
When we take the teeth out and place the implants, which is done at the same time under IV sedation, the infection goes away, it clears up, the implants get strong, and now the teeth are supported by the implants.
Okay, and then the gums get healthy again.
Absolutely.
Now, we should mention, I think you've been a dentist since you're about 4 or 5 years old.
Well, not
your
quite.
Dad,
But,
I know your dad, your brother, your sister, everybody's a dentist.
That's right. Born into a family of dentists. My dad being the first in the lineage. My brother is a dentist, and my sister's now in dental school.
I heard you fought it though. You waited till you were 22.
I did. I wanted to go out and pave my own way. I actually wanted to be a pilot, but in the end, I ended up following in my father's footsteps, and I joined up in practice with him, and I did that for close to 16 years. Yeah, the things that we can do today in dentistry just weren't available in my dad's time. As far as taking somebody with gum disease, taking somebody with failing dentition, and converting them to teeth that don't come in and out based on the implants all in one day. This just was unheard of 10 or 20 years ago.
So at your practice, some people, because of budget, you make a lot of dentures. I mean, you guys do a lot of dentures. Is your goal though to slowly convert them, and do you?
I'd love to see everybody end up in teeth that don't come in and out. You have to have the implants for that. But yes, we do a lot of dentures. We do some snap dentures as well, which is kind of like an in-between. So they're still dentures, but they snap in and out on the implants. I had this one patient that wanted to do the snap in, snap out dentures, and she had them for about a year, but she's like, Dr. Matt, there's certain things that I'm still struggling to eat. I can't bite into an apple. The steak is I got to cut it up into small pieces. So we converted her to the teeth that don't come in and out, and whoa, it changed everything. She can eat all those things now, and then some. She told me, Dr. Matt, I wish we'd have done this a long time ago.
You said they all have regrets, and we're going to go to your photos right now, but they all have regrets that you said they should have done it earlier.
Without fail, almost everybody says they wish they would have done the implants and the teeth that don't come in and out from the start.
Now, you've been doing this for about 20 years. How important is it? I know it seems like an obvious one, but how important is experience in when you choose a doctor that does this? Because you've been doing it 20 years.
Well, there are studies out there that show that experience does matter, like a lot of things. That a doctor that's been placing and restoring implants like myself for close to 20 years versus somebody who's been doing it for, say, less than 12 years has a much higher survivability rate of the implants. The implants just basically last longer.
So you have like your own lab where you make the teeth right there?
We have lab technicians in the office. We also have 3D printers. We're up with the latest technology.
Like printing the teeth?
Printing the teeth.
Okay.
We can design the teeth with the patient in the chair with a software program called SmileFi. So we take our iPhone or iPad, take a picture of their teeth, and we can sit there and in 5 minutes design something that they want that looks fantastic, and we can take that all the way through to their temporaries and then to their final zirconia. Let me show you some examples. I brought some pictures. A lot of these are before and after, so you can see the dramatic change in the appearance of these individuals. So this lady came to see me. She had no upper teeth in the back. She couldn't eat or chew, and she worked in the restaurant business. She was a manager at a popular chain that everybody knows. And one of the things that they taught her in her training years and years ago was how powerful a smile can be. She couldn't do it anymore. She felt like she was failing at her job. She felt miserable all the time. And she did not want a denture. That was one thing she made apparently clear to me.
Okay.
So she didn't want anything that came in and out, nothing that she had to use the messy glue for or anything like that. So we took out this lady's failing teeth and replaced them with dental implants. Now she has teeth that don't come in and out. So take a look at the before and after.
Yeah.
Would you say she looks younger?
I would say so, yes. And happier.
And happier, I was going to say happier. So now her employees tell her at her restaurant that she's their favorite person to work with.
Okay.
And that's something that she hadn't heard. So imagine this lady who worked in a restaurant and couldn't eat more than half the things on the menu. She was just bragging the other day of everything that she can eat. She can eat steak without having to cut it up. She can bite into an apple. She can eat all their sticky, chewy desserts that they have on the menu. So
what do they like more? How it looks or what they could eat?
That's a good question, because a lot of patients come in and they're focused on one thing, either the form or the function. What can they eat, or how it's going to make them appear.
Okay.
But the thing is, they get both. That's the benefit of it. So if they came in because they want to just look better, they want to look younger, they want to be able to smile more, but now they have the benefit of being able to eat things that they thought they'd never be able to eat again, it turns out those are the things that they talk about the most.
Okay.
That's what they tell their friends and family about.
Now, you say when they see their teeth for the first time, some people like break down. They're crying. Is that right?
There's a moment of realization when the patient's sitting in the chair, we hand them that mirror after the teeth have been delivered, and they get a glimpse of what they used to look like, how they used to feel. They thought they'd never see that person again. Absolutely. It's amazing. Sometimes they tear up, but it's a touching moment, and sometimes the staff even tears up. Let me show you this next patient and how dramatic this one is.
Okay, now, by the way, we're going to take a quick break. And when we come back, let's get to that photo. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
For my 10th anniversary, my husband had given me my smile back. And so every time he looks at me, he says, "Smile." And so I give him the smile. And one of the things that my husband noticed, that I speak clearer to him without my dentures, that I have the teeth. And he hears me better. He understands my words. And I love it. I love the teeth. I love the smile. It makes me feel much better about myself that I can smile and have teeth to show. I'm sure I'm going to gain weight because I love to eat everything, and especially peanuts, to just chew on them and eat an apple. I can actually chew a steak, which is wonderful.
This is Just Stewart, coming live from Florida. Dr. Matt's hooked me up with a new grill, top and bottom. Before, my teeth were rotten. I was afraid to go out in public, restaurants. Now my whole life's changed. I'm going out, I'm being adventurous, I'm doing things. It's taking my life to a whole nother level. Thanks, Dr. Matt.
You know, I was really excited to get dentures when I got them. I thought it was going to be the end of all my problems that I had. But I found out that I couldn't eat anything. So when I got these, I can eat anything I want to eat now. I already just feel like they're my teeth again. My healthy teeth that I used to have when I was a kid.
I have struggled with my teeth for years. I am so pleased with my mouth now. I could smile without my teeth coming out, and I just couldn't be happier.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. Today we're talking about getting upper and lower teeth that are permanent or fixed, that don't come in and out, with Dr. Agnini. Dr. Agnini, thanks for coming on the show. Now, you have a photo you're about to show me.
I have a lot of photos here, but just look at how dramatic this before and after is of this young man. And I say young because in the picture, he looks like he's in his 50s or 60s. Randy, just look at this guy. If you look at this picture, you'd think he lived on the streets. Unfortunately, people get judged for how bad their teeth look, and they know that. So
That's got to be unusual, though.
It's
something
not,
that bad.
What happens is, we asked this gentleman to smile for us, but he never smiled like that. He hid his smile. So he had the reputation for being just a grumpy guy, or a guy that nobody wanted to hang out with. A guy with no friends. His options were traditional dentures, which we do all the time for patients. But he didn't want something that was removable. He wanted something that was fixed in his mouth that felt like his teeth.
Okay.
Take a look at this. This is the same guy.
Jeez, that doesn't look like the same guy.
It doesn't look like the same guy at all. More vibrant. This guy ended up getting a job right after he got his teeth that he thought he would never get into. He said that it's affected his life in every aspect. People just tell him how much younger and happier he looks.
Well, he definitely looks more handsome. But you say that's everybody. Smiling makes you look more attractive.
Absolutely. It's just a good smile is a powerful thing. It exudes confidence. It's survey after survey show this. It's one of the things that individuals will say they notice first when it comes to attractiveness with other individuals. Not only does he look better, now he can eat whatever he wants. He feels better. He's eating what he wants.
So maintenance, he just comes in and what? Every 6 months, gets them cleaned?
So for maintenance for these patients, they come in once a year.
That's nice.
Yeah, we clean the teeth and take an x-ray, take a look, make sure everything is doing well, make sure they're doing what they need to do to keep them clean at home, and that's it. They move on.
Okay, you have more photos?
Absolutely. You'd never know it from looking at this picture, but this gentleman is in the multi-million-dollar real estate business. He's a real estate broker. And he had a tooth that he was putting in and out himself every day. He kept it in his pocket so he wouldn't lose it. And when he was with a client, he popped it back in, and he wasn't happy about that, if you can imagine that. This guy is no stranger to the dental chair. He's had, I think, every tooth in his mouth was crowned or veneered. He'd had root canals, caps, and he sat in my chair and said, "Dr. Matt, I know you could probably replace this tooth with a single implant, but I'm tired of keeping up with everything else. It seems every time I go to the dentist, another crown's coming off. I need another filling, another root canal, and I'm just kind of at the end of the line with that. What are some options for me?" So we immediately started talking about full mouth implants and the teeth that don't come in and out, which is what we ended up doing.
You say with like as little as 4 or 6 implants, you give them a full arch of teeth that don't come out. Is that right?
That's correct.
Okay.
The average number is between 4 and 6 implants per arch. And he left that day with that smile.
Whoa.
Those are teeth that don't come in and out based on the implants. A successful real estate guy, and before didn't look the part, now he does.
Looks good. And he, again, I know this, I mean, he can eat whatever he wants.
He can eat whatever he wants.
So do they come in, you say they act differently even when they come in? Like their personality changes, like their confidence is back.
When these patients come back in to see me in a matter of weeks or months for their follow-up, they just exude confidence. They're smiling ear to ear. To be honest, sometimes I don't recognize the patient right at first.
Really?
It's that dramatic. Another one here, sometimes we have to tell these patients to smile. It takes 2 or 3 attempts to get the shot because they just haven't smiled in so long. This is another lady that had broken down teeth. She was embarrassed to smile. And she said, "Dr. Matt, I can't wear a denture. It's just, that's not me."
Okay.
So we ended up doing the full mouth implants for her, upper and lower, the teeth that don't come in and out. Look how much happier she appears to be. This picture was taken a month or 2 later, but in one afternoon, these are the teeth she left with. One thing that these patients have to learn how to do is smile.
Okay.
And so many of them haven't smiled in so long, they don't, maybe they thought they'd never smile again. So you can see how it looks a little bit forced. She definitely looks happier, but that smile is going to soften up in no time at all.
You say they start taking selfies and they're posting them online, like on Facebook or whatever?
Absolutely. They start taking selfies. Sometimes they may start online dating. They tell me that they've met new friends. It's a life-changing experience.
Really?
It's a life-changing experience.
Just because of the teeth?
In life, if there's something that you don't like about yourself, it's definitely going to hold you back.
Okay, good
There's
point.
no doubt about it. This is one of my favorite stories here. This gentleman, you wouldn't know by looking at him, but he was a successful man in business. And he had the unfortunate event of a motorcycle accident 10 years ago. Ended up losing 6 of his front teeth, not right away, but after many visits to the dentist. And one of the things the dentist told him at that time was that he lost a lot of bone around where those teeth came out, and now he's going to have something removable for the rest of his life.
Not in your office?
Not in my office. You wouldn't know it by looking at this before picture, but this gentleman's in his 40s now with what we did with teeth that don't come in and out all in one day. He looks age appropriate. As you can see, he's so not used to smiling. I'm not worried about that. That's going to soften up over time.
And then he just, and again, eating, was it hard to eat with those teeth before?
He couldn't eat hardly anything. He told me this, his own words, he'd entered a kind of a depression and had been in such a slump that his friends, his family, everybody noticed. It affected his job. So now that he's got the new teeth, it's almost like a new lease on life for him.
That's nice.
Yeah. He's even got grandparents, aunts, and uncles that are coming in now that he's had this for a few months that are asking if they can chip in to help him pay his teeth off.
Are relation like couples, married couples, does one come in and then the other one comes in? Do they ever do it together?
Absolutely. As a matter of fact, I have a patient that we just finished them last week, and they're both in their 80s. Both came in, both decided dentures are not for them. They like to travel, they like to RV, they are on the go, and they definitely love to eat. So one day I did the husband, the next day we did the wife, and they ended up with their final zirconia teeth last week and couldn't be happier.
And, you know, and like you explained, when people are lucky enough to be 80 years old, your life revolves around eating and traveling and experiencing the local food. And so what do you say to the denture wearer that's out there watching this? And I know you guys do a lot of dentures, but let's say they hate their denture. What do you say to them?
Well, there's another way. A lot of people have resolved that they're stuck, or maybe they feel guilty, it's their fault. But it's not always the individual's fault when they lose all their teeth.
Okay.
There is going to be another option, and it's going to be life transforming. We can get rid of those dentures and add teeth to them that don't come in and out.
Nice.
Also, patients that know that they're headed toward dentures, now there's another option. We can do something.
So even if their teeth are loose, and really bad gums, they can get this done.
Absolutely.
Like new teeth, upper and lower.
You've seen the proof here.
Okay. Now I know you have more photos, so I'm going to rush you a little bit because we only have a few more minutes left. What else we got?
We can go through some of these quick, but you can just see the dramatic impact that this could potentially make in someone's life.
So that's her smile before, just doesn't show teeth.
I keep going back to age, but just look how much younger. Wouldn't you say she looks younger there?
Yeah.
If you look at the before here, this is typical of somebody with bad teeth. Maybe somebody with dentures, but a lot of folks that come to see me that have teeth that just look horrible. They're tired of being judged. They're tired
So they don't even show their teeth when they smile.
Yeah. In one afternoon, the patient can leave with teeth that look just like this.
And they don't come out.
Yeah.
It's good.
Absolutely. I've got a couple more to go through here with you. I like this picture, Randy, because it's almost like he's grimacing in pain. I asked him to smile to show what he had in his teeth, and he told me he doesn't smile.
Okay.
I said, just for the picture, you're going to be amazed at the difference when we're all finished with this procedure. So he had his eyes closed, but that was a good trade-off because he did show me what he had before. So I had him close his eyes for the final shot, just for consistency. Yeah. Again.
That's very nice.
He's taking baby steps with his smile, but it'll get there. He'll be smiling ear to ear in no time. Here's another patient. This is a nice lady that came to me. Also, told me that she cannot wear dentures. It's something that she's been deathly afraid of, and it's why she's been putting off getting her dental work done in the first place.
Okay.
I told her there's another option, and now with teeth that don't come in and out, dental implants, we can do this all in one day, and the patient can leave with something that looks just like this. And the best part about it, Randy, they never have to wear dentures. So
with patients like this, if everything works out, as little as maybe 3 appointments, they get their new teeth.
That's correct.
Okay.
We utilize the latest in 3D and printed technology. The final teeth for these patients, the zirconia, are CAD/CAM milled, computer generated, but it all starts with what the patient wants.
All right there.
All right there.
And you say you're less than the other guys that you know of in Florida.
That's correct.
It's more than competitive pricing. You are less expensive.
Absolutely. It was a thing for patients to have to consider even traveling overseas to get procedures like this in the past, but not anymore. My goal was to make this more affordable for the average person, and that's exactly what we've done, and it's one of the reasons that's contributed to our success.
Now we talked, in the green room, because look, we're in San Diego, our newsroom, and Mexico's right there. And I know their prices because I've talked to some dentists from there. Mm-hmm. And you're less than they are.
Now that I've told
Because
you
a lot
what
of
my
people in
prices
Florida
are,
are traveling.
exactly. We're less than a lot of these places, and for sure, and a lot of we come in under what a lot of folks are doing in the Orlando and the Villages area. You know what I'd like to do, Randy?
What's that?
For anybody that's watching this show that mentions this show when they call, I'm going to offer a $500 discount per arch.
Okay.
So per arch means upper or lower or both. So
Just a wellness hour. They saw you interviewed on TV.
mention the wellness hour and they can save up to $1,000.
Okay, we are out of time. So final message. The two groups of patients you said, they've got bad teeth, bleeding gums, loose teeth. And then the other group are the people that are currently wearing a denture. Maybe even you made the denture for them, but they're just sick of their denture. And they've heard what you had to say, but they're still skeptical or afraid, saying maybe I'm too old or whatever. What do you say to them as your final message?
Some things I hear from patients when they finally get into my chair, why they didn't come in earlier, they're afraid. Or maybe they didn't know their options.
Okay.
Or maybe they've been told they didn't have enough bone. These are all things that are genuine concerns, but in reality, they're things that aren't going to prevent them from getting the implants in their teeth.
So at least come in for a consult.
Come in for a
Do
consultation.
they get to meet you?
They get to meet me, and especially if they've been told they don't have enough bone. There are things we can
Yeah,
do.
but isn't it true? I mean, if you've been wearing a denture like 10 years, 15 years, you can't do this because you don't have enough bone.
For sure, if somebody's been wearing a denture for a number of years or even decades, they're going to lose a lot of bone. But there's things we can do now with alternative site implants that weren't available years ago. And we can still do this. The patients still leave with the teeth in a day.
Is that right?
Absolutely.
So even if what if they've been told in another office you don't have enough bone? Get a second opinion?
Come see me. Come see me. We can take care of it. I'm one of the few docs in the Orlando Villages market that has training for these alternative site implants, specifically for patients that don't have enough bone or that have been told they don't have enough bone for dental implants.
Very nice. So now, if somebody wants to make an appointment, they can go online, schedule there, or you prefer they call your office?
We have the number down below. They can give our office a call directly, or they can visit our website.
Now, you have a QR code that we're going to put on the screen. If they click that, they can go to...
It'll take them right to our website. They can
Okay.
see the promotion that we're offering there for those who've watched the Wellness Hour, and they can give us a call and schedule an appointment that way. One thing I'd like to mention is we offer other services as well. We do dentures, we do snap-in dentures, we do individual teeth implants.
You say a lot of places only do one thing.
A lot of places do one thing and that's it. A lot of people would love to have the teeth that don't come out in one day, but they can't afford it. So we have something to get them started. And a lot of times patients will start with dentures or snap dentures and then graduate to the fixed teeth later on. There's many possibilities. We have something that can help just about anybody.
All right, Dr. Agnini, I want to thank you for coming on the show. Good stuff. All these are on your website, these before and after photos?
Yes, they are, and more.
Okay, good. Thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.